Hi and welcome to Guitar Ergonomics Conversations. In this video together with hand surgeon Mark Phillips, Mark is talking about the work that he has done with guitarists and other musicians. And he's showing some of the statistics so you can see what kind of conditions are most common for guitarists and other musicians as well. It's a really interesting video because it also will tell you a little bit about that if you did have to visit a hand surgeon, what the procedures are and what you might expect. I hope you enjoy this video.
This is what I've just found out. So I've had 621 patients, of whom 242 are musicians. So that's 39% of my patients in the last 4 years. And I've been looking at my new to follow-up ratio, that is the number of follow-up appointments that patients get, because I suspected that maybe musicians had more follow-up appointments before they were discharged, follow-ups for every patient compared to 2.42 for non-musicians. So that's not too bad. But I think musicians are very keen when they are better not to be discharged, because it's quite difficult to get back in the clinic, and they think if they've got a problem again, they'd be quite keen to be seen again. So they make a 6-month appointment even though they haven't got any clinical problem. And so discharging them is more difficult. And this is what I found, that I've got about 50 guitarists, a lot more pianists, and a lot of people. This includes people with second instruments and third instruments, etc. So quite a lot of people would have a second instrument of being a piano. I think that's why that's come up so high on the list. How many cellists there are. And harp is definitely disproportionately represented as well, given how many harpists there aren't in the world. And those instruments, the string instruments, as you can see, are strongly represented there as turning up in hand clinics. And then we had a little look to see whether patients were musicians or not musicians by age. And what that shows, I don't know if you can see that here, but essentially, if somebody's a musician, it shows blue on here, and more than half, or about half of the patients are, in the younger groups, are musicians, and in the older groups, it's mostly non-musicians. So I think it's a slightly younger demographic, is what that's saying. And these are the conditions that people have. So in this one, the musicians are showing up as the sort of orange-red color. And pretty much the conditions they have are the same as other people in similar proportions. There might be a little bit more ganglion in non-musicians, and there's a little bit of variation, but generally it's pretty evenly divided between musicians and non-musicians. The tests that I do, nerve conduction studies, MRI and ultrasound, I've done lots of those, and fairly evenly spread between the musicians and the non-musicians. And these are the treatment pathways, largely steroids and hand therapy, and again, even proportions between musicians and non-musicians. Decompression procedures for tendons, trigger finger, and carpal tunnels and things like that. And general anesthetics and local anesthetics represent neck, elbow. Again, all fairly evenly distributed between musicians and non-musicians. And then I searched by instrument, by specific conditions, just to see if, say, guitarists got carpal tunnel syndrome more often than other people. And if you look at all 621 patients, including the non-musicians, you see that the overall incidence of carpal tunnel syndrome is about 25% in my clinic. It's the commonest condition I see. Guitarists slightly more, pianists slightly more than the average, and violin and cello slightly less, but I don't know that that's statistically significant. So again, it's more or less in the ballpark. Arthritis, I thought, would be interesting to see whether guitarists got arthritis in greater numbers, or pianists got arthritis greater than others. And overall, I'm 7% of my patients, 7 to 8% of my patients having arthritis mentioned in their letter. Piano slightly higher at 10%, guitar 7.8%. So generally not very different to the rest of the population. The word tendon being mentioned, again, around 50% of my letters contain the word tendon, and it's not much higher in guitarists or pianists. So that's a brief little summary of what I'm up to so far with analysing my work. So musicians get similar conditions to everybody else, but what I do find in the clinic is that actually it affects them much more adversely, even with milder forms of each of those conditions. The investigations are sometimes normal because the severity is mild and it's below the threshold for most musicians. And then the diagnosis becomes difficult. You've got to use your clinical skills to try to come up with a diagnosis, maybe using steroid injections or asking a hand therapist to put them through some 2-be-on a 2 if they aren't playing in public anymore, and then they become a 2-be-on a 1 if they can barely practice, and a 2-be-on a 0 if they can't play at all. 2-be-on was a Parisian surgeon in the 1970s in Paris who started this musician's hand thing. And all of those things happen. Musicians slide down that scale very quickly, even with the slightest degree of any of those conditions that we've talked about. It's and then of course, to make them better, you've got to be very gentle with it, because often it isn't a very bad degree of the disease process, and you've got to find a little nudge to make them better. So surgery is not commonly considered. It's mostly things like steroid injections, hand therapy, splinting, advice, ergonometrics, and that's where you come in. And as we've talked about before, it's that bringing together of hand therapist and hand surgeon and technique educator that's so valuable for this special group of patients.
Yeah, there's one thing that I certainly have noticed over the last 2 decades, and that is that certainly amongst guitarists, and I wonder whether you think this is common amongst other musicians, is that they wait quite a long time before they seek help. And obviously that becomes an issue in terms of recovery and so on. Do you think is the case still?
I think it has been the case in the past, certainly. I think the threshold is dropping a little bit. I think one of the reasons that musicians tend to hold off a lot is they're frightened that the surgeon will take over, do some horrific thing to them, and be career limiting. And that fear has been addressed a little bit by BAPAM, who are often the first point of contact, being reassuring, and then letting them know that basically people like me and you and hand therapists are now familiar with the conditions that they have and find fairly harmless ways of making them better, things that are unlikely to injure them or make them worse, and that we're basically a lot gentler with musicians now than we used to be, I think. So I think that word is getting out there, and so people are presenting earlier and coming with pathology which is a little easier to correct. I'd say that's true.
Do you think, now that we obviously have the internet and so on, do you think that when the musicians are coming to seeing you, do you think they already have a better understanding of, first of all, what you may be able to do for them, but also maybe what they might suffer from? Or do you think that actually the internet is the opposite? It creates misconceptions and so on.
The patients have often Googled stuff. They're not that well informed. And that's okay. And some patients come very well informed. My work, and actually there's still a lot that I can do for them when they come to the clinic. There's still an awful lot of education, realistic advice that I can give them. So I wouldn't. I think many of them are overwhelmed by the amount of information that's available on the internet, and I think I can help to deal with that when they come to me, and help to sort out some of the information that they've got a vague handle on. So yeah, they're better informed in many ways than they used to be, because I've been in this 20 years like you have, but they're a bit muddled, and it just needs a bit of crystallizing, which I think helps. Yeah,
I've been very fortunate, never have had to have any hand treatment, but are you able to explain sort of, if a guitarist came to see you, depending obviously on the issues that they're presenting with, but what could they expect to happen sort of in a consultation with you?
Well, basically the standard clinical consultation that we do with BAPAM is about 40 minutes as a video consultation. And if somebody sees me for a new patient consultation, it's half an hour. And in that time, I'll crack through all the usual things. So it'll be basically taking a careful history, which usually takes 10 or 15 minutes. And then a clinical examination, which usually takes about another 10 minutes. And then a discussion of the treatment plan and the investigative pathway. And usually in the first visit, it's simply an investigative pathway, which would be some nerve conduction studies, MRI, ultrasound, as we discussed. It might be a referral onto a hand therapist, and then I'd get their opinion as to what they think their working diagnosis is going to be. And one of the other outputs, as you know, is that I often suggest to people that they have a session with you and I on Zoom, and then we can find technique workarounds that may help them, not to change their technique, particularly to suggest that their technique was wrong in the first place and may have caused the condition, but just to say that given this condition that they now have, is there a way that we can make their technique different that will work around the clinical problem?